Hi, I'm Dr. Toby Mayer here at the Beverly Hills Institute of Aesthetic and Reconstructive Plastic Surgery. Today we're talking about eyes in males and what makes eyes good, what makes them look happy, rested, calm. That gives someone a certain look that people say, oh, I look tired all the time, or you always look angry, and the person says, I don't feel angry, I feel normal. So today we're going to talk about a few examples of what makes eyes look that way. So everybody brings in males very often pictures of Johnny Depp or in this case Brad Pitt saying, oh, I like his eyes because he has handsome eyes. Well, not only are they handsome, but if you go like this, they're happy eyes. They're eyes that don't look sad or tired. He doesn't have droopy bags or brows that are sagging down. There are no bags in his lower eyes and no bags in his upper eyes. So if we look at this patient who looks nothing like Brad Pitt, but he said, look, I don't want to look like Brad Pitt, but I like his eyes look rested. I say, well, you have a bit of sag already where your eyebrows are down. It's obvious that he has normal lower lids. There's no fat bags there. There's no real aging hollowness there. That's his natural look. So we say, well, let's kill two birds with one stone. We're going to raise your eyebrows, and then we're going to give you hair because you don't have hair. And in order to do that, we do the Fleming-Mayer flap, which means instead of taking the little pieces of grass blades and putting them in one or two at a time and then putting in thousands of them, you can't get them close enough and they undergo a texture change. So we take an entire piece of sod from the side of the head and just twist it over here and stretch this closed where we took it from. So he ends up with a full head of hair, as dense as it was on the side of the head, and at the same time you see how we've raised his brows. So the distance, you can now see his lashes, you can see a space on his upper lids where he now has happy eyes versus those sad eyes he had before. So that's a big plus for patients, and we do the same thing in men and women to give them a rested look rather than doing their upper eyelids, which would leave the eyebrows where they are and he still would look sad. So you have to raise the eyebrows when someone has a sad appearance. What happens when we age further with that same process? And you see this gentleman has very, very low eyebrows that are below the bone. He's got bags in his lower lids. He's got excess facial tissue, and he's got a depression here. So what we're going to do is his primary problem, you see, is this and the bags. So the forehead has been raised with a forehead lift, and you see how this opens the eyes. So he no longer has this sad, tired, angry look. He has a happy look. The bags have been removed from his lower lids. This depression that he has here has been filled in with his own fat, as well as some in here. And you see it creates a non-pulled, he's had a facelift at the same time to help reposition all of this, as well as his neck skin, and remove that. So he looks rested. He doesn't look pulled or tired. And people don't say, oh, did you have a facelift? They say, boy, that vacation really helped you a lot. You look so relaxed and rested. And he also does not have an incision in front of his ear. So even if someone's thinking, oh, he must have had a facelift, you see he doesn't, because the incision's inside the ear. So as we look at eyes, and there's many, many more examples of each of these issues on our website, you can go to the website at www.bevhills.com and look at all of the pictures showing various types of eyes, noses, cheeks. Each procedure is shown with multiple examples.
You make me feel so young. You make me feel so spring has sprung, and every time I see you grin, I'm such a happy individual. The moment that you speak,